Hey everyone, it's Sarah, registerednursern.com, and in this video, I'm going to talk about why nurses are leaving the bedside. So first, what is a bedside nurse? Well, as the name implies, it's a nurse who provides direct patient care at that patient's bedside. And the bedside can be in a variety of places, but mainly it tends to be in a hospital setting. And most, not all, but most bedside nurses tend to work 12-hour shifts. You'll have a day shift and a night shift nurse, and they can tend to work, if they're working full-time, about 3 to 4 days a week. Now, if you have been following the news, you may be hearing about how nurses and other healthcare professionals are actually leaving direct patient care, which is bedside nursing. And you know, there has always been a talk in nursing that there's a shortage, or hospitals have always, in a sense, had waves of problems of finding nurses for certain positions, but it seems like things are getting progressively worse. For example, according to morningconsult.com, 18% of healthcare workers have quit their jobs since February 2020. In addition, a recent McKinsey survey found that 22% of bedside nurses may actually leave their current position within the next year. So these statistics are really alarming, and I want to share why I think some nurses are leaving the bedside, but I'd also love to hear from you all in the comments below about why you think that this is happening. So first, some nurses find that bedside nursing is extremely grueling physically, mentally, and emotionally. And the truth is that it definitely is. There's going to be some days when you leave a shift that you're going to question if you're actually going to go back, because that shift was very, very intense. So first, let me talk about the physical part of nursing that some nurses find just extremely taxing and demanding. Well, whenever you work as, let's say, a bedside nurse where you're working in a hospital for 12 hours straight, that can be a very physically demanding 12 hours. I like to compare it to like a marathon, because you've got to have physical endurance for that whole shift, because chances are, depending on whatever your day throws at you, maybe you'll have a good day, maybe you'll have a bad day, but you're probably going to be on your feet majority of that 12 hours. And breaks, sometimes you get breaks, sometimes you don't. It really depends on how your unit's set up and how you're relieved for breaks, because sometimes if you have patients who are extremely sick or just require a lot of supervision, you can't get those breaks that you need, because you've got to take care of your patient, and you'll feel guilt, or you'll just be too worried that something's going to happen to that patient because you don't have someone to watch them. Next, it's also very mentally exhausting. Whenever you clock in for that shift, your mind has to be on, and you have to be on constant alert, because you have all these patients, and depending on what floor you work on, you might have a lot of patients. You have to know what's going on with your patient, and every patient's going to have something different. You've got to be critically thinking. It's not just you're a robot following certain things. You have to know, okay, I can't give this medicine because this lab's here, or I've got to make this phone call to get this. And you're constantly thinking of all these things. Then you have all these different scenarios coming at you, because you're taking care of people, and people just don't follow this set thing. They have crazy things that happen. It's like Murphy's Law. All these crazy things are thrown at you at once, and you have to be able to juggle them and keep things straight so you can take care of these people and give them good patient care. And you know, whenever that shift is over, you have really maxed out your brain powers. So whenever you go home and people want to talk to you and ask you how your day was, you're literally like, I just want to sit and eat and go to bed. I just can't talk and make complex decisions because I'm so tired. And finally, it's emotionally challenging. So not only is it taxing physically and mentally, but emotionally. And this can really stem from whatever type of day you're having, because nursing, what you'll find out is that it will have its high moments where it's awesome, it's amazing, you've seen people get better and go home, but it's also going to have its low moments that will really test you, and really you have to prevent yourself from taking it home and from it consuming you, because you see so many crazy things that happen. So you can see traumatic things, you can deal with difficult people. This could be patients, this could be their family members, it could be coworkers, and sometimes it literally feels like you are in a war zone. instead of grenades and people shooting at you and things like that, you have call lights going off, you have patients throwing up, projectile vomiting, bleeding out, lethal rhythms, codes going off, and it just feels like this chaos going around you, and you're just here, and it's like, what do I deal with first? And as a nurse, because of this, you have to learn not to take the things that you're having at the hospital or at your work emotionally and take it home with you, because it can ruin your days off. It can cause you to experience depression. You know, you may start having dreams where literally in your dreams, you're replaying scenarios in your head, you hear call lights going off, and it's just horrible. So you have to protect yourself. Another reason nurses are leaving bedside nursing is because of COVID. So before COVID came along, nursing already had its own problems. But whenever we threw COVID into the mix, it amplified those problems and made them a lot more well known. So some reasons people are leaving is because they don't want to get COVID. So they're like, COVID's here, I'm done, I'm leaving anyways. I was already on the fence about this profession, so this just sealed the deal. Another thing is that family dynamics has really changed, in that children, some children are choosing to stay with online learning. Maybe they're not in school, they're being homeschooled. So that's really changed how their family is operating, and maybe someone who was part-time decided, hey, I'm just going to go ahead and stay home now with the kid and my spouse can work more. Another thing is that COVID has caused a lot of protocols and red tape for people, and the vaccine mandate is affecting people because some hospitals are requiring nurses to have the COVID vaccine, and if they don't, they are no longer employed. Another reason nurses are leaving the bedside is because of staffing. So as a bedside nurse providing that direct patient care, the amount of staff you have is essential to you being able to do your job. And whenever you're short-staffed, it's not good because you suffer, but most importantly, the patient suffers. And what happens is that you're required to do more, to take on more patients, regardless how sick they are, and things can start to become, in a sense, dangerous. So nurses, whenever that happens, they get overworked, they get burnt out, and they want to leave their job. And finally, because bedside nursing does have this high turnover rate where people are constantly quitting, you're getting new people, the people who are staying, they start to experience this like low job satisfaction because you don't have this teamwork mentality on the team, because people don't really know each other, you don't know their skill set, and so you sort of feel like you're like this one person taking care of all these people. You don't have people you can go to for help, and it leads you to feel, why am I here? Why am I doing this? And I'm just going to leave. Now, having said all of that, there are some nurses that absolutely love bedside nursing. This is their calling, their passion in life. This is what energizes them every day, and they can't think of anything other to do than bedside nursing. And the thing is we need bedside nurses because one day we're going to be in a hospital and we're going to need care, and we need that bedside nurse. And then on the other side, you have nurses who absolutely hate bedside nursing. It's not their calling, they don't like it, and they rather do something else. And that's okay because we need those types of nurses too. But one thing I can say about bedside nursing is that it provides amazing nursing experience. And it's really vital for you whenever you're first starting out to go into bedside nursing because it's going to teach you those fundamentals of nursing. Everything that you learned in school, it's going to start connecting those dots, and you're going to understand it. You're going to sharpen your skills. You're going to be applying that nursing process, critically thinking, and it's going to teach you how to think like a nurse and to become a nurse and go on and do whatever you want if you choose that bedside nursing is not for you. Okay, so those are some things that I have personally seen why some nurses leave the bedside. And I would love to hear from some of you all about what you think about this topic. And thank you so much for watching.